Professor Sayyid Zahid Jamal from NICVD.
Assalamu alaikum everybody. I'm professor at NICVD. I graduated from Dow Medical College and moved after doing my house job residence. Here I went to US, I did my medicine, then I went to cardiology, and then I went to a Harvard program. I did my cardiac electrophysiology, which was a unique subspecialty in Pakistan. I was the first one who came back with this specialty and introduced that subject here. I mean, the topic today is a real challenge for me. I mean, how to keep your employee. I'm one of the example. I'm stayed in one hospital to myself is an example. And when I came here, I went to all the places here. Why I decided to go to government hospital? When I went to AKU, I found the same setup. And the nurses were same, the same nursing station, the staff, the system was same. When I went to government hospital, it was totally chaos. There was totally, I thought when I came to Pakistan not to join to an institute which is already settled. So I wanted to take a challenge and joined a government hospital with less salary, but and where I achieved all my goals, my ambition. Every day I was doing something new. I mean, so I was so excited working there. Now, keeping what I found, the biggest challenge coming back from US to Pakistan. In US, what I said, I was doing moonlighting in a hospital where I was running managing 300 patients. I was the only doctor. And there were 40 nurses, okay? What I found here, it was totally opposite. That system is all run by paramedics, and they are the backbone of your medical institute. I was just reviewing how many medical colleges we have in Pakistan, and I asked my son just to check it out. And he said 176. I asked, how many is medical college in US? He just gave me information last night, it was 156. Then I asked him, why don't you check how many nursing schools are there in Pakistan? Only 200. And how many nursing schools in US? 2,500. So you can tell where we are lacking. So we are making more medical colleges. We are not producing high standard, high technical skill staffs, which in US nurses are running the clinics. They are writing prescriptions. They are physician assistant, they are nursing assistant. I don't know where we are going, why people are not producing high quality nurses and technicians. That's what I need. Because as a doctor, I see my patient for 10 minutes, and rest of the patients handed over to the nurses and paramedic staff, even in the ICU. So this is the biggest challenge. To keep the employee, and NICVD is the biggest example. We have sucked all the best nurses, even from AKU, and from all the private institute. How we were able to, Dr. Azhar is sitting here, our CEO, and she knows why people join NICVD. Number one was the incentive. What was incentive is a financial incentive. So we got the best of the best nurses at NICVD in the government setup. And how to retain them, that's very easy. I mean, it's a government, so they get a scale and they rise, and so they know where the future is. No one wanted to leave NICVD because they have incentive, their future is guaranteed. They are, after their retirement, they get all the incentives are there. And and we have opened 12 hospitals. So opportunities are there. So people are going to their own hometown, especially from Sakkar, from Ibru Khas, from Tando Muhammad Khan. We are doing 500 bypass surgery in Sakkar. So all the local people have moved happily, and we are giving extra incentives, money to them, even for my doctors who were offered here as senior registrar, same salary and double salary in Sakkar as an assistant professor. All my students, they join as AP in Sakkar, near to their hometown. So NICVD Karachi is a center where we train people. I have 250 cardiology fellows. Can you imagine? The biggest, largest, and I am the director of my fellowship program, and my curriculum is same as Harvard Medical School curriculum. I did not do anything. I just copied my training into my institute and have the highest number of postgraduates who passed FCPS. This year, 29 out of my FCPS passed in first attempt. This is a record. And these high quality are being delivering in Tanu Muhammad Khan, Sevan. Just one of the minister got a cardiac arrest in Hyderabad. We went to Hyderabad Sakkar, Hyderabad NICVD. He survived, and it was done by most junior of my trainee. And I could not imagine. He was one of the best trainee. And he did the angioplasty in the middle of the night. That's what we want. To these centers like this, Karachi, Zahid University, you should be providing training center here, and then he should open different tertiary center where they can be. So I'm just sharing my experience.
Right. Thank you, Dr. Zahid.